You cannot call yourself a real acupuncturist if you don't master Moxibustion techniques. In this video, we will explain to you what Moxibustion is, and we will show you a lot of different types of Moxibustion techniques you can use in your practice. Moxibustion refers to various therapeutic techniques in which dried mugwort is burned to produce heat. When mugwort is dried, it produces a punk that is called moxa. Moxa can be used directly or rolled into moxa rolls. The function of moxa are mainly to stimulate acupuncture points, to warm the channels, to move qi and blood, and to tonify. Moxa can be used for musculoskeletal conditions, period pain, chronic respiratory conditions, digestive conditions, and all kinds of deficiency patterns, and even can be used for boils and abscesses. It is also quite common to use Moxibustion for life preservation or yangsheng. Moxibustion is contraindicated in conditions such as infections with fever, iron deficiency pattern, with some exceptions, convulsions, and extreme exhaustion. It is also contraindicated on the apex of the heart, on large blood vessels, on the genitals and nipples, and on the lower abdomen and lower back in pregnant women. We will now see how to conduct the different Moxibustion techniques in the clinic. The first technique will be direct Moxibustion. So direct Moxibustion is when we use directly the moxa cone on the skin and we burn it directly on the skin. So in order to do that, we are going to need some equipment. First, of course, it's our moxa punk, and then we'll need something to light it on. So we have the lighter, or we can also use incense as well. We have the moxa, some examples of moxa cones here, and we'll have a container to put the ashes, and we have this to push the moxa cone in it. So before we start, let's make sure our patient is comfortable. She can stay in this position for a couple of minutes during the session. And we'll also have to make sure that the point where we are going to do the Moxibustion is fully uncovered. There is nothing, no cloth or towel or anything else around. So this is all good. Now we're making our moxa cones here. So you can just use the punk like this, and you will press it with your fingers to create a cone, or shape of a cone. It doesn't have to be perfect. In general, it will be around 1 centimeter in diameter and 2 centimeters in height. And it will depend on the school and also on the type of Moxibustion, type of condition you are treating. So now we have all this ready. I'll just wash my hands and we can start. Generally, you want to have the skin as flat as possible. If it's not possible to have the skin flat, for example, with stomach 36, you can use a bit of Vaseline to make sure the moxa cone will stick. In this case, the skin is relatively flat, so we should be fine. Let's see. Okay, it can stand well. So I'm going to light it up. I need to to prepare my patients. So I'm going to light on the moxa cone. So after a while, you will start to feel some heat. So this is completely normal. Once it starts to be too hot, you have to let me know, and I will just remove the moxa cone. Is that okay?
Okay.
Yeah, awesome. So let's go. Here we go. It will burn for maybe 20 seconds approximately. Generally, when it gets to the bottom third of the cone, it will start to be burning for the patient. So when it gets too hot, you just remove the cone directly. So you push it, for example, with this spoon in the container. So how does it feel? Does it start to be hard at all, or?
It feels a bit warm.
A bit warm. Okay, good, good, good. How do you feel now?
Yeah, it feels a bit hot now.
Is it too hot?
Yeah, a little bit.
A bit too hot. Okay, so we just remove it, and so we can just let it extinguish naturally. So generally, when we are doing direct moxibustion, we won't let the moxa cone burn the skin. But there is a technique called blistering moxibustion, in which we let actually the moxa cone burn completely, and so this will actually stimulate very strongly the acupuncture points. But this also burn the skin, and there might be some blisters. There might be some marks left after the treatment. It's very strong, but also not every patient will agree with this kind of treatment. So this was direct moxibustion. The second technique is indirect moxibustion. So indirect moxibustion is when we're using a buffer substance between the moxa cone and the skin. So the buffer substance can be a slice of ginger, can be garlic, can be salt in general. Today we're going to do a demonstration with ginger moxibustion. So we are using slices of ginger. You can see that the slices of ginger are approximately 2 to 3 millimeters thick. So we don't want it to be too thick, otherwise the heat will have trouble to penetrate. And in order to make it easier for the heat to penetrate, we are actually going to use a needle, just right here. And we are going to make some holes in the ginger slice. So we just 5 or 6, good. And now we are ready. So I'm going to put the slice of ginger right on CV4 Yuann. So again, as any other moxibustion therapy, we'll need to have the patient ready and comfortable. We'll need to have all our equipment ready right here, and also make sure the area is uncovered. So you can see here, my problem is that the towel is way too close to the Moxa stick, so I'm just going to put it slightly down to make sure I have enough, so I have more space now. Okay. Now I have my Moxa cones right here, so I'm going to put the cone on the slice of ginger, and I am ready. So I'm going to light it, and again keep continuously communication with the patients. So Linda, I'm going to now to light the Moxa cone, and you will start to feel some heat. If it starts to be too hot or burning, just let me know at any time. Okay.
Okay.
It will take a few seconds to burn. What we can do to make sure the heat is continuous is just put directly another cone here ready, and I will put it here. So this cone is ready. When that cone will be almost extinguished, I can just light this one up, and then the heat can just be continuous. Do you feel any warm feeling at all, or?
Yeah, it feels warm.
Feels warm. Just let me know if it starts to be too hot. Just let me know at any time. So be ready, stay around, and continue to ask the patient how things are going. If it starts to be too hot, what you can do is just take the slice of ginger with your hands.
Yeah,
is it too hot?
Warm.
It's a bit too hot. Okay. So because we have very thin slices, I'm just going to remove it, and then I can just light on the next one and continue the treatments. So I'll just move it around and continue. Okay, so this is indirect moxibustion. You can see it's easier to control compared to our direct moxibustion. It will need a bit more equipment, but otherwise it can be a very good technique, very practical in the clinic. As we mentioned earlier, it's possible to roll the Moxa punk into a stick like this, and this will actually facilitate our job as a moxibustion therapist to make it more practical and simpler actually. So before you start anything, as usual, you will need to have your patient ready in a comfortable position in which the patient can stay at least for, let's say, 20 minutes during the time of the session. Then you make sure your equipment is ready and at hand available readily. So we have our Moxa stick here. We can light it up with the lighter. We can have a container for the ashes, etc. This is very important that you have before you light on your stick, you will have a plan in place to make sure you can extinguish the Moxa stick at the end of the session. So this is very important to remember that. Now we are ready, the patient is ready, the equipment is over here. I'll wash my hands now and we can start. So, in order to avoid using too much oil, what I will do is I will use this alcohol-soaked cotton, and this will give me more time to take my time to light the stick here. Make sure you do it thoroughly. Some people tend to rush a little bit. When you rush and the Moxa stick is actually not completely lit on, it may extinguish it naturally, so you will have to do it again. So it's important that the end of the stick is lit completely. So we're taking our time, making it right. Good. Okay, it looks pretty good. So you can see that now the end is completely lit, and we can start to do the moxibustion treatment. So what you can do is to put your fingers, so you will be able to check the temperature at all times. It's a very good practice. So Linda, just let me know if you start to feel some warmth sensation, or let me know if it's too hot as well.
Okay. Yeah, that feels good.
Good. In general, there are a few techniques you can use. First is the circle techniques, so it's basically having a circular movement around the points. And you have the sparrow pecking technique, which is going up and down like this. So you make sure it's never too hot. How do you feel? Is it too hot?
It's warm.
It's warm. Okay, good. This is a relatively safe technique. It's very rare to have burns if you're using a Moxa stick. Some patients can actually even use it at home if you are comfortable with them to do so. So it can be a good option for long-term treatments when the patient needs to continue treating at home. It's a bit warm. So we can also do the moxibustion along the channel. Here it will be the stomach channel. When you're doing that, make sure you don't rush too much. If you do like this, there will be no sensation at all. But if you go slowly like this, can you feel the sensation of warmth on the channel? Yes, good. We can also see that there is a red halo around the point where we're doing the moxibustion. This is actually normal. This will go away after the session, but this shows that the stimulation is going on. So this is a very good point. And the skin starts to be a bit hot as well. Another thing you have to be careful about will be to remove the ashes in an ongoing manner. So we'll have the extinguisher over there, and we'll just press the stick around the container to remove the ashes. That's good. Just do it from time to time. Yep, I can show you with this. So with this container, you would just press like this. So don't press too hard, otherwise it will, the stick may fall down. Yep, so we can continue. Is it too hot?
It's getting a bit warm,
It's not unbearable, is it?
No, it's bearable.
Bearable. Okay, once we are down now, we need to extinguish the Moxa cone. The best way to do so is to use Moxa stick extinguisher. This is specially designed for Moxa sticks. So you just put the Moxa stick in the cone, in the hole, and it will extinguish it automatically after a few seconds. Another way to extinguish it will be to use to cut. So actually, it's almost cut. So it will be to cut the Moxa stick here to make sure that the end that is lit on will fall down. Make sure you have enough space, so don't do it too close to the end, otherwise inside the stick there might still be some Moxa burning. Also avoid to use water to extinguish the Moxa stick. This will make it very wet, very soaked, so you will have trouble to light it up the next time. So you don't want to waste your material. This is very easy to find in any acupuncture shop, so feel free to get a few ones if you want to use Moxa stick moxibustion. So here it is. Smoke is definitely the main problem of moxibustion therapy. In order to overcome this problem, we can use Smokeless Moxa. So Smokeless Moxa is basically a Moxa stick, but instead of our normal Moxa stick, this is made from charcoal and traditional herbs that are mixed together into a very rigid stick like this. So I'm going to show you the difference between the two. First, I'm going to light them on, and we're going to see that the first difference between the smokeless stick and the normal Moxa stick is that it's much easier to light the normal Moxa stick, and the smokeless Moxa stick will take more time. So you can see now the non-smokeless, the normal Moxa stick is almost completely lit, but the smokeless Moxa is hardly begun to be lit. This is normal. Will take a bit longer. It's not excessively longer. It will be just a couple of minutes. So you can see that the normal cone is completely ready now. I could start the treatment right now, but the smokeless Moxa one will take more time. So I will show you now. You can also see that the stick is becoming white as it's lit. Alright, so now we're ready. You can also compare the smoke produced by the two cones. So we can see the difference on this. Definitely produces a lot more smoke than the smokeless Moxa here on my left. So this will be the major advantage of smokeless Moxa. In terms of heat, they produce actually the same heat, so there is no difference in clinical efficacy. Another major difference will be when you extinguish them. Again, we're going to use our Moxa extinguisher, so you will realize that it's much easier to extinguish. Oh. So this is actually full. So this happens, you'll have to empty your extinguisher from time to time, otherwise you won't be able to put more Moxa. Yep. So here we are. And if we wait a few seconds, we'll see that the stick, the normal stick will be extinguished very quickly. The smokeless Moxa stick will take more time. We can also use Moxibustion in combination with needling. In order to do that, we will use very small Moxa sticks like this, which are called warm needle sticks. So we have the needles ready already in the skin of the patient, and generally you need to have larger needles, so it will be at least 0.25 millimeters or higher. Otherwise the needle will bend and there is risks of burns. So it's very easy. We use our small toothpick like this, and we create a hole on one side of the Moxa stick. So don't penetrate the whole Moxa stick, otherwise it may fall down. So once you have done that, there is another trick that is very useful, is if you have a bit of alcohol. So this side of the stick will just soak it a bit in alcohol, and you will see it will make it easier to ignite it. So we're going to do 2 rolls today. This is another one. Here we are. Alright. So now we are ready, and I'm just going to insert the roll in the needle. So you can use your fingers to maintain the needle as you're pressing with the other hand. Okay, so here we are. You see the rolls are inserted, and I will just slide it on. It's very quick and easy, and this really combines the advantages of both the Moxa and the needling, and the warmth will actually penetrate through the needle inside the tissues. So this is a very good technique to use. It will take about 10 minutes, 5-10 minutes to burn completely. Once this is done, you can remove the ashes with this spoon, so we're going to do that later. So when there is no smoke coming out of the roll, you can check if the roll is already completely extinguished. So you can use your scope like this, and if like this the Moxa cone is coming easily, it means completely extinguished. If you're having some trouble, so you see here I'm having some trouble to take it out, it means it's still burning. So don't force, don't push, otherwise you're going to make a mess. Just leave it burning for a few more minutes, and then we'll take it out, we'll remove it. So now I'm going to remove the other one. So you see the scoop, the Moxa scoop, is actually a spoon in which there is a little hole like this to put the needle. So I'm going to remove this now. Here we are, very easy. And then we can continue, we can do it again. We can reiterate the process 1 or 2 times during the session. We are now going to talk about Moxa boxes. And Moxa boxes are really convenient and practical because you don't need to handle the Moxa stick. So you will see here different sizes and different shapes of Moxa boxes. So you may use them on different parts of the body. Some are better for the limbs, some are better for the abdomen, some are better for the back, etc. You can adjust depending on what you need. So the concept is very simple. It's putting the pieces of Moxa sticks inside the box, and then we ignite the Moxa sticks, and then it will create the Moxibustion. All right. So let's go on with that. I will put the Moxa box directly on the lower back of the patient. Oops. And again, I make sure the area is uncovered, so it's safe. And now I'm going to light the Moxa sticks inside the box. So you can see the box is made of wood, and inside there is an aluminium magnesium coating to protect the box. I'm going to wait until the end is completely lit, and then we can close the Moxa box. So here the patient is relatively thin, so we don't need a very big box. I'm just using our Moxa box with 2 sticks. If the patient is larger, you can use this kind of boxes, and you will see you can put 6 different sticks here, and you will cover a much larger area. Okay. Now the Moxa sticks are already burnt and are burning. We can still keep the cover on, and you will see that Moxa boxes are very easy to manage the level of heat inside the box, because you can actually have some actions. What you can do first will be to open or close this cover here, and of course if you're cover it, there will be less air inside the box and it will extinguish the Moxa sticks. If you open it, there will be more airflow going, and it will create more ignition, more burning. There is also the little holes on the side. So again, the same idea. If you open it, you will create more airflow, so it will burn quicker. If you close it, it will burn slower. So you can adjust that depending on the sensation of the patient. I hope you enjoyed this video. My name is Yoann Birling, clinician, lecturer and researcher. This video was produced by Sydney Institute of Traditional Chinese Medicine. Please check our tutorials and more information on the school in the description below. You can join our community and also give this video a thumbs up if you liked it. Good practice and take care.